the first real big tip that I would have is to try and prehabilitate as best as possible, as distinguishing from rehabilitation. So what I mean by that is that if you can try and maintain mobility as best as possible, it makes the recovery period that little bit easier for you. The second thing I think that would be really helpful is to have in your own head a perioperative and post-operative plan, and that's something that you typically will discuss with your surgeon ahead of time. So to understand that this is the day I'm going in for my surgery, this is who I'm going to meet on the day, I'm expecting that I'll likely be in the hospital for a day or two, and to have, a list of contact numbers, who to contact if there's a problem, and so on. And the third thing I think that would be important is to have in mind realistic goals. Understand that, the hour that we spend in theatre is not going to translate to immediately walking out the door and running a marathon. It's very likely to be somewhere between 6 and 12 weeks before you're feeling closer to normal, but that the vast majority of patients get there and they're delighted with the outcome.